Hi everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today in episode 82, I want to discuss hypothyroidism, whether it's a mistake or a protective mechanism by the body. So in allopathic medicine, we're typically taught that hypothyroidism is just a mistake by the body. The gland just loses its function, and that's just the way it is. We really don't know why it happens. Some progressive doctors will tell you it's an autoimmune attack called Hashimoto's thyroiditis that causes it, but there's really nothing you can do about it. It's just a mistake by the body. And by the way, don't worry about it. We're just going to put you on thyroid hormones for the rest of your life. Well, I want to make sure that you understand that in most cases, from all the time I've done in the last 20 years, digging into the literature, digging into the research, I fully feel that based on everything I've read and seen, and especially in clinical practice, that hypothyroidism isn't a mistake by the body. I really don't think the body makes that many mistakes. What I think is really going on, especially from all the literature, is that hypothyroidism is a protective response. So let me explain my stance. So you are just made of cells. You're tons and tons of cells in the body, and those cells have a really important part in communicating to the brain, to other tissues, what's going on. So we've just all these cells, and we have this state of what we call homeostasis, or balance within the cells. The cells are always regulating ebb and flow of their metabolism. So when you eat, metabolism goes up. When you have less food, metabolism goes down. And so there's ebbs and flows within the cells. But when we put excessive amounts of stress, whether that stress is physical stress from excessive training or injury, or it's chemical stress from medications or drugs or toxins, or emotional stress, the things that we think about, or it's microbial stress, bacteria, viruses, parasites, or other organisms, excessive amounts of cellular stress can push the cell into something called a cell danger response. The cell perceives some kind of threat. And when that cell perceives some kind of threat, it goes into this danger mode and goes from making energy to really trying to kill something. And there's a couple things that are incorporated into this cell danger response. One of those things is something called inflammation. Now, typically people look at inflammation like a bad thing, but actually inflammation is a good thing in most cases when it's under control. Inflammation is a signaling molecule. So when tissue's damaged or there's a threat, damaged cells release inflammatory chemicals to trigger the immune system and the rest of the cells that say, hey, I'm in danger here, come help me. And so inflammation becomes a part of the cell danger response, and we can have signs and symptoms from inflammation. The other thing that happens is the body starts to, or the cells start to deactivate the thyroid hormone in your peripheral cells, which means away from the thyroid gland. And so when the body deactivates the thyroid hormone inside the cells, that's ultimately why you have hypothyroid symptoms. Most people believe that their hypothyroid symptoms are caused by the gland not making enough thyroid hormone. But it's really not about as much what the gland is making, because we can always provide you a prescription of thyroid hormone to substitute what the gland can't make. So it's not about what the gland makes per se. It's not about how much T4 or T3 is in your bloodstream. It's really about how much T4 and T3 gets into your peripheral cells and actually gets converted to active T3, and that T3, how much of that T3 actually binds to your nuclear receptors. That's what really determines cellular metabolism and whether you have hypothyroid symptoms or don't have hypothyroid symptoms. So under this cell danger response, the stress response, thyroid hormone is deactivated in the cells. That triggers your hypothyroid symptoms. And again, this can happen with totally normal TSH, totally normal T4, because the cell's under threat and the cell is deactivating the thyroid hormone locally. This is designed to be a very short response, and the whole idea here is to kill the threat or address the threat, whether it's low oxygen, whether it's a toxin, whether it's a bacteria or a virus, whatever the cell threat is, the cell danger response kicks in to hopefully temporarily get rid of the threat. If it's short term and the cell danger response actually addresses the threat, then the cell returns back to normal homeostasis and balance. And we've all experienced this. If you've had a viral infection or a bacterial infection for 3, 4, 5, 6, 7 days when you didn't feel good, you were in cell danger response and you were in a state called cellular hypothyroidism. You were experiencing hypothyroidism for those 5, 6, 7 days. But as the cell danger response actually started to address the threat, then your body went into a cell healing response that brought you back into normalcy. And so you go back to feeling the way you always do. The problem is if this cell danger response becomes chronic, because we have chronic physical, chemical, and emotional and microbial stressors that just don't seem to go away, then the cell danger response becomes chronic. And when that cell danger response becomes chronic, then we have chronic deactivation of thyroid hormone locally, leading to chronic hypothyroid symptoms. And if those, beyond the chronic hypothyroid symptoms, we also start to see that the body goes into an adaptive response, because when we have chronic hypothyroid symptoms inside your cell, we have decreased cell metabolism, we have decreased cell energy. So if we have decreased cell energy, then a number of systems have to start to become compromised. So we'll see insulin resistance start to develop, not because the person's eating too much carbohydrates, but because they don't have thyroid hormone inside the cell to get the glucose in their blood into their cells. We'll start to see a rise in cholesterol because something called the Krebs cycle is not being used to generate and make ATP or energy, so something called acetyl A is shuttled out of the cell to go make more cholesterol. We'll see decreased stomach acid production and reflux occur, not because we don't want acid production, but because if you're in a chronically stressed state, eating food and digesting food is less important than trying to kill the threat. And we'll see things like irritable bowel syndrome and depression. These things all get treated as the disease or the disorder, when in reality, these are all the effects of chronic cellular hypothyroidism, or chronic deactivation of thyroid hormone in your cells. And if this lasts for an extended period of time, the next thing, or one of the things we'll eventually start to see, is that the immune system will try and deactivate thyroid hormone globally, not just within the individual cells, but globally. And the way to do that is to shut down the gland. And we look at autoimmunity in these cases, again, not as a mistake by the body, but again as a protective response. Okay? So what's the most important part of this video today? That is, we have to stop looking at hypothyroidism as this mistake by the body and the idea that we can just keep flooding the system with thyroid hormone to normalize TSH and T4 to fix the problem. The cells are busy trying to deactivate your thyroid hormone, both inside the peripheral cells and to shut down the gland's production, because it's saying, hey, we don't need all this thyroid hormone because we have some type of cellular stress. And so instead of trying to normalize TSH and T4, what we really need to do is we need to find out what are those stressors. What are the physical stressors, the chemical stressors, the microbial stressors, and the emotional stressors that are driving this cell danger response, that's driving the thyroid hormone deactivation and causing your chronic hypothyroid symptoms, and for many of you are causing your chronic insulin resistance and diabetes, your hypercholesterolemia, your high blood pressure, your weight gain, your irritable bowel syndrome, and all these other challenges that you're struggling with are all very likely driven by the same mechanism. The problem in allopathic medicine is they're not up on this. It's not in their wheelhouse. It's not what they're educated on. They're taught to prescribe a medication to normalize TSH and T4. So continuing to go back to an allopathic doctor to say, hey, listen, I want you to help me fix my physical, chemical, and emotional stressors. I want you to help fix what's causing my cell danger response and the deactivation of my thyroid hormone locally. They're never going to understand what that concept is because it's not part of their model, nor were they taught that in school. If you're looking to really get long-term help from your chronic hypothyroid problems, you need to search for a functional medicine practitioner like myself, who's not going to try and just force the chemistry to be normal, but actually look for what's triggering your chronic cellular stress, your chronic cellular cell danger response, and the chronic deactivation of thyroid hormone and triggering your autoimmunity. All right. If you have any questions, put them wherever you watch this video or reach out to us at the office. All right. Take care.